Hello everyone. Today let us discuss about immunomodulation through herbal medicines. Let us see why immunomodulation has become a hot topic nowadays. When the immunity becomes weakened, only then the diseases affects the people. So by enhancing our immunity, we can live free of diseases. What is immunity? Immunity is the balanced state of multicellular organisms having adequate biological defense to fight infection, diseases, or other unwanted biological invasion while having adequate tolerance to avoid allergy and autoimmune diseases. A robust immunity, thus determined by a healthy digestion and hence metabolism, the daily and seasonal regimens which we follow, and the health and calmness of the mind to altogether providing a good quality OJS. Cells of immune system. The WBCs like neutrophils, eosinophils, basophils and monocytes. The lymphocytes like T cells, B cells, natural killers and macrophages. Where T cells modulate the immunity through helper and killer cells, and B cells produces antibodies or immunoglobulins. Body attains immunity through two ways, innate and adaptive. And adaptive is two types, active and passive, and these two again two types, they are natural and artificial. Innate immunity has three varieties: species immunity, racial and individual immunity. Species, example, anthrax is not affects birds. Racial, Africans are more immune, and individual, some individuals are more immune to some diseases. In the acquired immunity, active immunity developed through an infection is natural active and through vaccination is artificial active, and the passive immunity acquired through the mother's breast milk is natural and through antibodies received from a medicine is artificial. What is immunomodulation? Immunomodulation refers to any process in which an immune response is altered to a desired level using regulatory T cells, cell signaling molecules and so forth. Microorganisms are also capable of modulating the response of the immune system to their presence in order to establish or consolidate an infection. Thus, immunomodulation can be beneficial or detrimental to a host. Immunomodulation is possible in two ways: suppression and enhancement. In impaired immune response, it is enhanced, and in autoimmune diseases and in organ transplantation, it has to be suppressed. This individual immunity is ultimately defined by genes. Nobel Prize winner famous biochemist Hargobind Khurana has stated this fact. Ayurveda also says Kapha-dosha predominant Prakriti has more innate or natural immunity. Primarily activating immunity is the first level of defense. They are anatomical barrier, that is skin, mucous membrane, etc. Second, chemical barrier, saliva, HCl in the stomach, etc. And the third, phagocytic barrier, macrophages in WBC, Langerhans cells on the skin, etc. And fourth one is the inflammatory barrier. Thus, inflammation is also an immune response. That is, the good cell is going to kill the bad cell. A rapid and well coordinated innate immune response is the first line of defense. How body reacts to an infection? When the microbes enters the blood, the macrophages engulf them. They are converted to small fragments and reach the lymph nodes. Then the T cell activation takes place where the helper cells and the killer cells are active. This will initiate different signaling pathways. Thus, the inflammatory markers known as cytokines are produced. These cytokines sometimes act as pro-inflammatory and sometimes as anti-inflammatory, and the balance between these two functions are deranged in the autoimmune diseases. If a person has achieved primary immunity, it gives an immunological memory which helps in sudden response during the next viral or microbial attack. When the innate immunity doesn't work, antigen-antibody reaction or the second level defense is activated. A problem in this level is also a cause for autoimmune disease. The immune overreaction through internal threat causes autoimmune diseases like rheumatoid arthritis, IBS, type 1 diabetes, etc. And through external threat is allergic reactions. Immune underreaction due to internal threat is cancer, HIV, hepatitis and TB, etc. And due to external threat is the infections like bacterial and viral infections. There are over 100 different types of autoimmune disorders. Immune response in COVID-19. In the initial stage, delayed release of cytokines and chemokines occurs in the respiratory epithelial cells. Later, the cells secrete low levels of antiviral factors, interferons, and pro-inflammatory cytokines and chemokines, causing infiltration of the inflammatory cells into the lung tissue, resulting in lung injury. This again causes apoptosis, damaging pulmonary microvascular and alveolar epithelial cell barriers. Results in vascular leakage and alveolar edema. This causes hypoxia in the body. SARS-CoV-2 infection caused an inflammatory cytokine storm which leads to extrapulmonary multiple organ failure. Resolution of COVID-19. Reducing the viral load through interventions in the early stages of the disease and controlling inflammatory response through immunomodulators are effective. Immunomodulatory methods. Ayurveda, the ancient science of life, has explained two methods through which a healthy person can maintain his health and a diseased can attain health. They are Swasthavritta and the Adharvritta. That is, dietary and lifestyle regimens and treatments of the disease. Dietary regimens such as wholesome diet with all the tastes where the sweets can be taken in the beginning, which is warm, freshly prepared, should be taken considering one's digestion at proper time in proper quantity, avoiding mixing of raw and cooked food or water with calm mind in a hygienic environment. Also, everyone must avoid taking food prior to the digestion of the previous food and taking viruddha ahara or incompatible foods because both are cause for the indigestion or the incomplete digestion, hence the deranged metabolism causing many of the diseases. Vitamin C concentration. When 50 times concentration is there, WBC can destroy the maximum number of viruses and bacteria. Daily regimens should have a healthy start. Engaging in some physical activity will add more energy. Here, upper respiratory tract infections increases in both cases of sedentary or overtraining. Mental health is as important as physical health. Adharvritta includes application of the principles of diet, sleep, behavior, personal and social hygiene for healthy and sick people, including pathyas and apathyas or diet and activities along with the treatment of the disease. Treatment of the disease has two dimensions: Roga Shamanam, recovery of the disease, and Roga Apunarbharam, that is, to stop the recurrence. The actions of medicines are ultimately aimed on two outcomes, Uttiskaram and Rogatram. Remember the fact that the microbe is nothing and the body is everything. According to William Boyd's textbook of pathology, virulence of microorganisms depends on the resistance of the body. The body will be always trying to fight against the affected disease through its vital force, and the medicines and the pathyas are only helping this vital force to attain its aim. Making use of the pathya ahara viharas, we can sometimes get cured from the disease without the medicines in its initial stage and which has only the mild pathology, and the modern science explains it as the spontaneous cure. A 100% disinfection of the environment, water, food, etc. would be a dream. Disinfection can be done only up to the extent where we can survive on the earth. So, immunity enhancement should be done from the childhood by living in connection with the nature by taking immunomodulatory herbal medicines, that is Ojavardhanam. Ultra sanitation, too much clean. A lack of exposure to bacteria, viruses, and allergens may prevent the normal development of the immune system. Many scientific studies have been conducted to study the immunomodulatory actions and the efficacy of different herbal medicines separately and when they are in combination in a yoga, that is herbal mixture. There are many herbal medicines which are acting as best immunomodulators, such as chyavanaprasham, brahmarasayanam, kushmandarasayanam, abhyamaragam, etc. And this should be used only on the prescription of an Ayurveda consultant. Roots of actions of Ayurvedic medicines are four types: psychological, physiological, cellular biochemistry, and epigenetics. Health benefits of chyavanaprasham. There are many benefits of chyavanaprasham. It is useful in cough and cold. It is especially used in pulmonary TB. It improves intelligence, memory power, skin luster, age, strength of sense organs, immunity power, and appetite. Chyavanaprash has amla as its main ingredient, which is a powerful antioxidant. Master Charuka is the first to mention these herbal medicines. Dose 1 to 2 teaspoons along with a glass of milk every morning before breakfast. If you are not accustomed to milk, you can take with water. Its uses release constipation, improves memory and concentration, calms the nervous system, enhances fertility and keeps the menstruation regular, purifies the blood, eliminates the toxins, and it is beneficial to the liver. Improves complexion and fight against bacterial skin infections, acts as antidepressant and tranquilizer for people suffering from depression. Promotes absorption of calcium leading to stronger bones. Teeth, improves muscle tone by enhancing protein synthesis, highly recommended for children and old people. Its regular consumption will protect you from diseases of respiratory system. The qualities of the chyavanaprasham are the following. Smell of cinnamon, cardamom and long pepper. Taste is spicy taste, more sourness and less sweetness. Water test. When a piece of chyavanaprasham is put into water, it should sink immediately. The particles should not spread in the water. Consistency: pulpy semi-solid paste, neither too solid nor too watery. Such a chyavanaprasham of a reputed company will be of good quality. Why drink milk after taking lehyam? According to Ayurveda, many of the herbs used in all lehyams, including chyavanaprasham, are hot in potency. So, to retaliate that, one should drink milk which is being cold mitigates the hot potency of the chyavanaprasham. Chyavanaprasham can also be taken along with water. Substitute for cow milk are goat milk, water, fruit juices, amla juice, your regular beverages such as coffee, tea, etc. When a teaspoon of chyavanaprasha is added to a cup of milk, ideally prepared chyavanaprasha should not curdle it. But some market available chyavanaprasha curdles the milk. If it is the case, better to take with water. Milk need not be taken soon along with the chyavanaprasha. Taking milk in any other time of the day is also fine. Preventive medicine. Chyavanaprash is not heavy to digest, though it contains oil, ghee, etc. The hot potency of the herbs and spices like long pepper, cardamom, cinnamon, etc. make it easily digestible. Herbs like Brihadi, Kandakari, Pushkarmula, Shati, Vasa, all these are very powerful herbs for respiratory tract disorders like cough and cold, etc. It is effectively used in the treatments of throat infections, chest infections, gout, and diseases conditions involving the urine. It is a powerful anti-aging herbal product. It also cures wrinkles. Also effective in cough, cold, asthma, respiratory disorders involving difficulty in breathing, chest injury, voice problems, chest disorders, cardiac disorders, gout, excessive thirst, urinary tract disorders, semen and sperm anomalies. It helps in the rejuvenation of the aged and also in proper nourishment of the young one. Master Charuka, who explained chyavanaprasha in his Rasayana, that is anti-aging remedies chapter, also enlists its usage in diseases like cough, cold, etc. There are many clinical research studies which have been conducted with chyavanaprasha, proving its immunomodulatory cytogenic actions, effect on glucose tolerance and lipoprotein profile, etc. are published in famous medical journals. A total of 80 herbal medicines are used in the preparation of lehyam in classics, but nowadays the unavailability of many herbs has reduced the number of herbs to half the original number. Most of the ingredients have the immunity enhancing properties and oxygenating properties. The ingredients like guduji, nisha, lashuna, ashwagandha, tulasi, kadugarohini, amalaki, adimadhura, dravanti, haritaki, vibhitaki, bala, pipali, gokshura, shatavari, brahmi, pipali, krishna, etc. are immunomodulatory in action. A clinical study on ashwagandha explains that it enhances the total WBC count on 10th day, bone marrow cellularity has been increased, thus the enhancement of the phagocytic activity of the peritoneal macrophages. Withania extract inhibited the delayed type of hypersensitivity reaction. Guduji enhance lymphocyte proliferation, macrophage activation. Nisha regulate the numerous transcription factors, cytokines, adhesion molecules and enzymes that have been linked to inflammation. Also inhibits the growth of variety of pathogens including parasites. The best time to take chyavanaprash is in the morning 15 minutes before the food, a teaspoon to a tablespoon based on the age with a cup of milk. Chyavanaprash is one of the best medicines used in anti-aging treatment called Rasayana therapy. Here, after Pancharma treatment, the patient is made to take Chyavanaprash for a few weeks to a few months of time. Chyavanaprash mainly improves respiratory immunity. So, for a person with early morning allergies who suffers from air pollution and pollen allergies throughout the day, or who has more asthma attacks during the daytime, taking Chyavanaprash in the morning is very effective. It mainly delays the aging of the cells and improves the oxygen supply to the deeper tissues. This happens by its antioxidants and rejuvenating herbs. And it is not merely the immunomodulatory herbs helps in immunity enhancement, but the way you think, eat, live, all matters. And according to Bruce H. Lipton, the famous biologist, the moment you change your perception is the moment you rewrite the chemistry of your body. So, a famous quote from Mahatma Gandhi: "It is health that is real wealth and not the pieces of gold and silver." Thank you for watching. Wishing you a wonderful day.